I'm Brandon Long with McAfee and Taft. I'm an attorney that represents and helps healthcare highways. And just to kind of start getting the boring disclaimer stuff out of the way, this is not intended to be legal advice to you. Be sure to consult with your lawyers. This is just trying to give you a kind of a glimpse of what 2025 might hold from an executive action regulatory guidance perspective. So the executive order was issued on February 26th. And the title of the executive order is Making America Healthy Again by Empowering Patients with Clear, Accurate, and Actionable Healthcare Pricing Information. President Trump is very focused on pricing and making sure there's more transparency in the marketplace. We saw regulations and guidance requiring hospitals to disclose pricing information and also requiring health plans, which is what we're talking about here today, to disclose pricing information. Some of this we forgot about. A lot of it, when you hear about this, maybe listening to this today, you'll think, oh yeah, I kind of remember that. But it's kind of been set to the side, and I think that is the reason for this executive order that was just issued. President Trump said in the executive order, for far too long, prices have been hidden from patients and employers. There is opaque pricing arrangements that allow powerful entities such as hospitals and insurance companies to operate with insufficient accountability regarding the pricing practices, resulting in patients, employers, and taxpayers shouldering the burden of inflated healthcare costs. In the executive order notes, in terms of the kind of the background or the purpose of the executive order, he points back to what he did in his first administration, and says, one of the requirements he notes is that health plans were required to post their negotiated rates with providers, as well as their out-of-network payments to providers and the actual prices they or their pharmacy benefit manager pay for prescription drugs. The executive order also reminds us that there's a requirement for health plans to have a consumer-facing internet tool through which individuals can access pricing information. First term, he required, and this all will probably sound familiar to you, machine-readable files. We had to have machine-readable files posted on an internet website that were publicly available without a password, where someone could go and find in-network rates, certain pricing information for out-of-network providers that the health plan has, and same thing with prescription drugs. This executive order kind of points to that and said, hey, this was already out there, and there seems to be a concern by the Trump administration that they are just not being enforced, or maybe they've been forgotten about. The executive order says, unfortunately, progress on price transparency at the federal level has stalled since the end of my first term. Hospitals and health plans were not adequately held to account when their price transparency data was incomplete or even not posted at all. I think a lot of you probably did go through the exercise or work with your TPA, your network partner, to ensure that these machine-readable files were handled and posted as they were required. My takeaway from this executive order is this is a really good time to dust off those requirements, work with your lawyer, talk to Healthcare Highways, or maybe your TPA, or maybe both. Just make sure that all of that is up to date and that your plan is in compliance. It's a really good time to kind of be reminded of what's required and to be proactive. In terms of the policy behind the executive order says it's the policy of the United States to put patients first and ensure they have the information they need to make well-informed healthcare decisions. The federal government will continue to promote universal access to clear and accurate healthcare prices, and this is a part I'd like to highlight to you, and will take all necessary steps to improve existing price transparency requirements, increase enforcement, which I don't like to hear. That sounds like the government will be auditing more plans to ensure that they're complying. In fact, I think this executive order probably directs them to do that. Again, this is a time to not play defense, but to play offense and be proactive, kind of thinking about what's required or what's been required up until now, and how your plan is either already in compliance or maybe we need to get up to date. The executive order requires the Secretary of the Treasury, the Secretary of Labor, and the Secretary of Health and Human Services to take all necessary and appropriate action to rapidly implement and enforce the price transparency regulations within 90 days of the date of the executive order. That clock is ticking. These agencies have to kind of get to work to require the disclosure of the actual prices of items and not estimates. That seems to be something that's, if you read this executive order closely, there seems to be a concern that There needs to be disclosure of the actual price of things and not just guesses or estimates. And then President Trump said that within 90 days they have to issue updated guidance on proposed regulatory action, ensuring pricing information is standardized and easily comparable. It's not real clear whether that means the agencies will issue new rules or proposed rules, or whether they will just kind of focus on what's already there. That'll be interesting to see, and it's obviously too early to tell. But I think that'll be an interesting thing to watch. And then they're also directed to issue guidance or proposed regulatory action updating their enforcement policies. The words, "we want to up our enforcement activity," that is code for audit. That is code for we want to examine plans and what they're doing and to ensure that they're compliant with the rules. There's focus here on the hospitals and providers, but there's also clear language focusing on health plans. The existing rules require most health plans to disclose the in-network provider negotiated rates, the historical out-of-network allowed amounts for providers, and the in-network negotiated rates and historical prices for all covered prescription drugs at the pharmacy location level. Some of the websites I have looked at, they might have the in-network file or the out-of-network file or both of those, but not the prescription drug file. Because it's been a few years and we've dealt with so many other new rules since then, in terms of the timing of when the prescription drug file in particular, when that was required or if it was required at the same time, something we should all dust off in our minds and make sure of. But for those of you that I would go to your website for your company or your plan and look and see what files are there. And if you see that you have an in-network file and an out-of-network file, but not a prescription drug file, for example, you might want to talk to your lawyer and your service providers about that. Is it current or was it posted 4 years ago and it's kind of stagnant now? These are the kinds of questions that I would be thinking about. Thanks so much for your attention and for listening to this short webinar. Good luck as you work to comply with this new executive order.